Allopurinol reduces the production of uric acid in the body. Uric acid buildup can lead to gout or kidney stones. Allopurinol is used to treat gout or kidney stones. Allopurinol is also used to decrease levels of uric acid in people who are receiving cancer treatment. Allopurinol co-therapy is used to improve outcomes for people with inflammatory bowel disease and Crohn's disease who do not respond to thiopurine monotherapy. Usual adult dose of allopurinol for gout is dose will vary with the severity of the disease. Initial dose is 100 mg orally once a day. Increase in increments of 100 mg weekly until a serum uric level of 6 mg per deciliter or less is attained. In mild gout, the average maintenance dose is 200 to 300 mg orally once a day. In moderately severe to facious gout, the average maintenance dose, 400 to 600 mg orally per day in divided doses. Minimal effective dose is 100 to 200 mg per day. Maximum dose is 800 mg per day. Usual adult dose of allopurinol for hyperuricemia secondary to chemotherapy is for parenteral. 200 to 400 mg per meter 2 per days IV is a single infusion or in equally divided infusions at 6, 8, or 12-hour intervals. As maximum dose, 600 mg per day. For oral. As initial dose, 600 to 800 mg orally in divided doses. Maintenance is adjust doses needed based on serum uric acid levels. Maximum dose is 800 mg per day. Usual adult dose of allopurinol for calcium oxalate calculi with hyperuricosuria is 200 to 300 mg orally once a day or in divided doses. Usual pediatric dose for hyperuricemia secondary to chemotherapy is for parenteral. Initial dose is 200 mg per meter 2 per days IV is a single infusion or in equally divided infusions at 6, 8, or 12-hour intervals. Maximum dose is 600 mg per day. For oral. Age less than 6 years is 150 mg orally once a day or in divided doses. For age 6 to 10 years, 300 mg orally once a day or in divided doses. For age greater than 10 years, 600 to 800 mg orally per day in divided doses. After 48 hours, evaluate and adjust doses needed. Allopurinol is a structural analog of the natural purine base, hypoxanthine. After ingestion, allopurinol is metabolized to its active metabolite, oxypurinol alloxanthine, in the liver, which acts as an inhibitor of xanthine oxidase enzyme. Allopurinol and its active metabolite inhibit xanthine oxidase, the enzyme that converts hypoxanthine to xanthine and xanthine to uric acid. Inhibition of this enzyme is responsible for the effects of allopurinol. This drug increases the reutilization of hypoxanthine and xanthine for nucleotide and nucleic acid synthesis by a process that involves the enzyme hypoxanthine guanine phosphoribosyltransferase (HGPRTase). This process results in an increased nucleotide concentration, which causes feedback inhibition of de novo purine synthesis. The end result is decreased urine and serum uric acid concentrations, which decreases the incidence of gout symptoms. Accompanying the reduction of serum uric acid by allopurinol is an increase in the serum and urine concentrations of hypoxanthine and xanthine due to inhibition of xanthine oxidase. In the absence of allopurinol, regular urinary excretion of oxypurines almost entirely occurs in the form of uric acid. After the ingestion of allopurinol, the contents of excreted urine are hypoxanthine, xanthine, and uric acid. Because each substance has its own individual solubility, the concentration of uric acid in plasma is decreased without exposing the renal tissues to a high load of uric acid, thereby decreasing the risk of crystalluria. By lowering the uric acid concentration in the plasma below its limits of solubility, allopurinol encourages the dissolution of gout tophi. Although the levels of hypoxanthine and xanthine are found to be increased after allopurinol ingestion, the risk of deposition in renal tissues is less than that of uric acid, as they become more soluble and are rapidly excreted by the kidney. Some severe side effects are skin rash, painful urination, blood in the urine, little or no urination, easy bruising, unusual bleeding, numbness, tingling, burning pain, worsening gout symptoms, or liver problems. Consult doctor if any of these side effects occurs. Common allopurinol side effects are an increase in gout attacks when you first starting taking allopurinol oral, rash, drowsiness, fever, chills, abnormal liver function tests, nausea, diarrhea, or joint pain. Caution is advised when consuming alcohol with allopurinol. Please consult your doctor. Allopurinol may be unsafe to use during pregnancy. Although there are limited studies in humans, animal studies have shown harmful effects on the developing baby. Your doctor will weigh the benefits and any potential risks before prescribing it to you. Please consult your doctor. Allopurinol is safe to use during breastfeeding. Human studies suggest that the drug does not pass into the breast milk in a significant amount and is not harmful to the baby. Allopurinol should be used with caution in patients with kidney disease. Dose adjustment of allopurinol may be needed. Please consult your doctor. Allopurinol may cause side effects which could affect your ability to drive. Occasionally drowsiness, dizziness or vertigo, ataxia and visual disturbances may occur when taking allopurinol. This may affect your driving ability. Allopurinol should be used with caution in patients with liver disease. Dose adjustment of allopurinol may be needed. Please consult your doctor.